Hi there, I'm Mike Gales for Everlast Nutrition. Now you have an injury and you're wondering, is it a better idea to apply ice or to apply heat? Well, this is a question I get asked all the time, and I figured I would put together this little video to make the answer just a little more clear. Now to answer that question properly, we're going to first have to decipher what type of injury you actually have. What we're looking to establish is whether the injury is chronic or is it acute. Painful injuries like bursitis or tendonitis occur over a longer period of time, and we consider those to be chronic. An acute injury, on the other hand, is considered fresh, meaning that it just recently happened. Let us first go over some common acute injuries. A sprain is damage to your ligaments, and a ligament is the fibrous connective tissue that connects bone to bone. A strain is damage to the tendon. Now the tendon is the fibrous connective tissue that connects muscle to bone. A contusion is when you have some sort of trauma that has caused some bleeding under the skin, but the skin is not broken. Basically, it's a bruise. A laceration, on the other hand, is when the skin has actually been broken. Basically, it's a cut. A fracture is when there is damage that causes changes to the integrity of the bone. It's a broken bone. Now, if you have excessive bleeding or suspect a fracture, then you really should bring yourself to the nearest emergency room as soon as possible. But in the meantime, you're going to want to control any bleeding. So if at all possible, try and clean the wound and then cover it with some sterile, non-stick gauze. Then apply pressure over the bandage and hold it until you can be seen by a doctor. As for a fracture, you're going to try to immobilize the injury so that it won't move, because you don't want to make it any worse. And get yourself to that emergency room as soon as possible. Now for the sake of this video, let's assume that you have either a sprain or a strain and that you're not bleeding externally. Yet you might have damaged some capillaries that are leaking blood internally. The problem here is that your body does not know that this skin has not been broken, yet it's going to react with an inflammation response to protect you just the same. To treat an acute injury of this kind, you're going to want to control the swelling and the inflammation in the area of the injury. Now to help you remember how to do that, the sports doctors came up with the handy little acronym, PRICE. The P stands for protection, and you're going to want to protect that injury. It's important that you stop doing whatever led you to be injured. If you rolled your ankle playing basketball, then it's not a good idea to keep hopping up and down on a hurt leg. You may need to use a splint to protect one of your digits, or a sling to keep your arm from getting more injured. And it really is true that sore thumbs do stick out, so find a way to protect your injuries. The R stands for rest, and you're going to have to recognize the fact that you are injured. So many guys get filled with machismo and they return to play way too early. Better that you take a whole week to recover properly and miss only 1 week than miss the complete season because you came back too early and got re-injured. Now the I stands for ice, and you're going to want to apply ice to the injured area for about 15 to 20 minutes. And you're going to want to repeat that application 3 to 4 times a day for the first 3 days. And so now the question is, why ice? And the answer is that ice will restrict blood flow, which will reduce swelling and reduce pain. Remember that broken capillaries may leak fluid, and your body will respond to an injury with inflammation. Now the problem is you only have so much space in that injured area, and all that inflammation is going to put pressure on your pain receptors, and that's going to hurt. So aside from the numbing effect of the ice, by reducing the amount of inflammation by restricting blood flow, you're going to really limit the amount of pain that you have to endure. Now here's a little tip when you're applying some ice. Now a lot of people will recommend putting ice directly on the skin, but I find that a little bit uncomfortable. So what I do is I go to the pharmacy and I buy these little gel packs for about $5 and I throw them in the freezer. They also sell little cloth casings for the gel pack so that the gel pack doesn't have to go directly onto your skin. And all you got to do is just put the frozen gel pack into the little cloth pouch. One last little tip, it may be annoying to sit there and hold this gel pack in place for 20 minutes. So what I normally do is I set the gel pack over the injured area, and then I usually use a compressive bandage, and I usually just lightly wrap it around to hold it in place. This way I can forget about it for 20 minutes and I can go about my day. The C stands for compression. Now once again, we're trying to reduce the amount of swelling, and a compressive bandage may help you do that. Now make sure that you don't wrap the bandage on too tight, because you want to reduce swelling, but you don't want to cut off the blood flow to one of your limbs. One little last note about these little compressive bandages. You want to start wrapping these guys distally, which is away from your core, and then in the proximal direction, which is towards your core. And the reason why you want to go from distal to proximal is so that you don't unnecessarily trap any fluid in your limb. The E in this acronym is elevation. Now remember, our goal here is to reduce the amount of swelling and inflammation, and we can use elevation and the force of gravity to help us do that. So what you're going to want to do when you're laying down is make sure that the injury is higher than the height of your heart. That will ensure that gravity is aiding blood flow back down into your core and that the blood is not being pooled in your limb. As for any medications, you should always first check with your doctor. But they will usually prescribe acetaminophen on the first day for pain and then ibuprofen after the first day to help reduce any inflammation. So we looked at the ice, but what about the heat? Well, after about 3 days, your body should have repaired most of the broken capillaries and the swelling should have subsided. At that point, you're going to want to apply heat to stimulate blood flow so that the injured area gets all the materials that it needs to speed up the healing process. Now, I like to use an electric heating pad for about 20 minutes, but you can use gel packs that are placed in a microwave, bean bags, a nice hot bath, or even a nice hot whirlpool. Now, after the initial inflammation has subsided, I would use both heat and ice. And this is the way I would also treat an injury that is chronic. If the injury is chronic, meaning it developed over a longer period of time, then you need to first ask yourself, why are you injured? An ounce of prevention is worth a pound of cure. And maybe you have some muscle imbalances or you're using some improper technique that led you to have this chronic injury. And those issues need to be addressed. So to treat those chronic injuries, you're going to first want to address the causes, and then maybe you're going to want to throw in some rehab exercises. In that case, I recommend that you use some heat beforehand to stimulate some blood flow and the elastic properties of your muscle. That will reduce muscle stiffness and increase your range of motion. You could then use some ice after your exercises to reduce any inflammation due to your training protocol. So a little quick recap for the chronic injuries: heat before your rehab exercises and some ice after. But the best piece of advice you're going to get is not to become idle just because you have an injury. Try and work around your injuries and focus on the things that don't hurt you. For example, if you have a shoulder injury, then don't just stay home. Put more of a focus on your core and on your legs. If it's your lower back that's bothering you, then do all of your exercises either lying down or seated to take pressure off that lower back. But at least do something. That way when this shoulder finally does heal, it's just my shoulders that are going to have to play catch up and not the rest of my body because I took the last 6 weeks off of the gym.